Hi, my name is Steven. So this is the IV infusion checkoff. So the first thing I'll do is I'm going to check my physician's order and gather all my equipment and supplies. Next, I'm going to be utilizing the the 6 rights of medication administration. I'm going to check the IV solution to make sure it is the proper solution with the prescribed additive. Next thing I'm going to do is I'm going to go ahead and calculate my infusion rate by dividing the volume by the infusion rate by the number of hours it should be infused. So I'll verify the calculation. So we have 1,200 milliliters that we're going to infuse over 6 hours at a rate of 15 drops per milliliter. So I would take the 6 hours and go ahead and times it by 60 to go ahead and get 360 minutes. And then I'm going to take the 1,200 milliliters and times that by the 15 drops per milliliter to get 18,000. I'll divide that by the 360 so I can get my drop fact of 50. So it'll be 50 drops per minute that I'm going to do. So after I do that, I'm going to make sure to remember the importance of infection control, and I'm also going to follow the standard precautions of the hospital, and then I'm going to go ahead and wash my hands and enter the room. All right, so knock, knock, knock. Hey, good morning. My name is Steven. I'm going to be your nurse today. So what we're going to do today is get you some fluids going. First, can you just verify your name and date of birth? Perfect. Do you have any allergies? No? Are you in any pain? No? Perfect. So what we're going to do is we're going to get some fluids going through your IV that's already placed. It should take no more than about 10 minutes or so to get it all hooked up for you, okay? So let me go ahead and wash my hands, and I'm going to get started. All right, so what I'm going to do is I'm going to also go ahead and take my IV pump, which is right here, and I'm going to go ahead and plug it in the wall and get it set up and ready, okay? All right, so I've already attached the IV pump to the IV pole and plugged it into the wall. So now I'm ready to get the administration set up. So I'm going to utilize the 6 rights of medication administration. I'm going to check the IV solution to make sure it's the proper solution with the prescribed additive. I'm going to check the expiration date on the solution. I'm also going to check the solution for any discoloration or particular matter. And then now I'm going to go ahead and place a time tape on the solution container with the prescribed infusion rate, the time the infusion began and that it ended, and then also I'm going to put my initials on it, which I've already placed on the bag. And then I'm going to go ahead and get my tubing. So I'll go ahead and remove the appropriate administration set from the package. I'm going to label the tubing with the date and the time, and I'm going to make sure that the roller clamp is closed. So go ahead and remove. I'll attach a label to the tubing that does the time and date. I'm going to go ahead and find my roller clamp. I'm going to make sure that it is closed and rolled all the way down and clamped. All right, perfect. And then I'm going to attach the appropriate device, the needle, the blunt needle or needleless device to the administration set. All right, perfect. So now that I got all that set up, now I'm going to go ahead and get my IV solution. All right, so I'm going to go ahead and remove my protective cover over the IV solution port. I'm going to make sure to keep that clean and sterile. Next, I'm going to go ahead and get my spike, and I'm going to make sure to go ahead and remove the spike, but I'm going to keep the end sterile. So I'm going to remove that protective cover on the spike administration, keeping it sterile, and I'm going to go ahead and now place the spike into the IV bag. Okay. All right, so now that I've placed it into there, I'm going to go ahead and confirm the tubing, the clamp is closed, which it is closed. And I'm going to go ahead and hang it. All right, so now that I have the IV bag spiked, if this was a glass bottle, I'd first clean the rubber stopper on the top of the bottle with an alcohol pad, and then insert the spike through the rubber stopper. And then what I'm going to do is I'm going to go ahead and compress the drip container chamber and allow it to fill halfway. All right, so I have filled it halfway now. And now I'm going to go ahead and prime my tubing. So how I'll prime my tubing is I'm going to slowly release the roller clamp to allow the fluid to flow slowly through the tubing. And so we'll go ahead and do that now. All right, so what I'm doing, I'm slowly letting it going through. If I do see any air bubbles, I'm going to go ahead and flick the tubing to make sure I can go ahead and mobilize those air bubbles. Just getting all those air bubbles out. right, excellent. Now I've got all the air bubbles out. Then I'm gonna make sure that the tubing is prepped. All right, so now that I've got all that done, I'm gonna turn on the IV pump and loaded the administration tubing according to the manufacturer's instructions. Then I'm going to program the pump for the primary infusion with the prescribed infusion rate, which is the hourly rate, and the volume to be infused. Usually amount in the IV bag, which this is a 1,000 ml bag. And then I'm gonna go ahead and apply my procedure gloves. All right, so next I'm gonna thoroughly cleanse the injection port closest to the patient with an alcohol pad. So I'll make sure that is thoroughly cleaned. Perfect. Next, I'm going to assess the patency of the IV line and the IV site by flushing it with normal saline. I'm going to monitor the ease of administration. I'm going to make sure there's no swelling at the IV site. I'm going to make sure there's no patient complaint or discomfort at the site. And then I will not give the IV medication until the patency of the IV has been verified. All right, so next thing, that is done. All right, so next thing I'm gonna do is I'm going to, using my 6 rights of administration, I'm gonna verify the IV solution to make sure that it's the proper solution with any prescribed additives. All right, so another skill to have is in case there's a power outage or we're out in the field, we need to know how to manually set the drip rate so that we can properly infuse the rate at the prescribed amount. So we're doing 50 drops per minute. Right. And to adjust it manually, you would use the roller clamp, adjusting it up or down, clamping it as necessary so you can get that drop rate appropriately. Just playing around with it until you get the appropriate thing where you have to actually sit there and watch it for a minute to get your exact drop rate, and you would just use that clamp to go up and down. So we're going to go ahead and check that now, and we're going to go ahead and watch this drop. That's 50 drops per minute. And then next I'm gonna go ahead and connect the IV set adapter to the IV catheter. Right. So I will thoroughly make sure that that port is clean again. All right, so next, keeping this sterile in, I'm gonna insert it in, have it connected. All right, so now that I've got it connected, I'm gonna unclamp the administration tubing, which means I'm gonna open the roller all the way, and I'm gonna press the start on the button on the pump. Next, I'm gonna ensure that all alarms are turned on and audible. Next, I'm gonna check the pump hourly to make sure that the correct volume is infusing. And then at the end of the shift or at the time specified by my agency, I'm gonna clear the pump of the volume infused, and I'm gonna record the volume on the I&O form. All right, so now we're gonna set up our secondary intravenous solution and administration set. First thing I'm gonna do is I'm gonna utilize the 6 rights of medication administration. I'm gonna check the IV solution to make sure it's the proper solution with the prescribed additive. And then I'm gonna check the expiration date of the solution. I'm also gonna check the solution for any discoloration or particulate matter in it. And then I'll, same thing is I will place a piece of tape on there that has the time. It'll also have the start and end time. It'll have the date. It'll have my initials. It'll also have the infusion rate on it. And then after I do that, I will remove the appropriate administration set out of the packaging. So I'll go ahead and remove it out of the packaging. Same thing, I'm gonna label the tubing with the time and date on it. So I'll leave. Okay, I will put that label with the time and date on it. All right, excellent. All right, now that I have that set up, I'm going to go ahead and remove the protective covering. And then I will go ahead and get my bag so it's lower. All right, so now that I've had that, I will make sure that the roller clamp is closed on here. I will make sure that I have the time and date labeled and everything on it. I will attach any appropriate device, if needed, a needle, a blunt needle, or a needleless device to the administration set. So next I'm gonna go ahead and remove the protective cover off of the secondary bag of the container port. And then I'm gonna remove the protective cap off the spike bag, or the spike, making sure I keep it sterile. And then after I have that, I'm gonna go ahead and spike the actual set. All right, so I've spiked it now. I'm gonna confirm that, make sure that the roller is closed, and then I'm gonna hang the secondary up, making sure that it is higher than the primary set. All right, and then I'm going to compress the drip container just like we did before, making sure it goes up to that fill line. Perfect, so I'll have it up to that fill line. And then I'm going to prime the tube slowly by letting it flow slowly through the tube so I can make sure all air is let out. If there are any air bubbles, I will flick it with my fingernail. So I'll make sure all the air bubbles are out and mobilizing. Perfect. Now that I have that, then I'll be ready to connect it to the tubing. All right, now that I'm ready to connect the secondary to the primary, the first thing I'm gonna do is I'm gonna stop the primary infusion, so I'll use the roller clamp to stop that. All right, next I'm gonna go ahead and thoroughly cleanse the injection port of the primary infusion bag that's closest to the primary infusion. And I'm going to connect the secondary administration set. So I'll go ahead and take that clamp off, making sure I keep sterility. And go ahead and connect that. All right, so next I'm gonna make sure I utilize the 6 administration, rights of administration, medication administration, I'm sorry. I'm gonna check the IV solution to make sure that it is the proper solution with the prescribed additives. I'm also gonna make sure that it has a compatibility with the primary infusion. Next, I'm gonna make sure that it is hung, the secondary solution is hung higher than the primary, so that primary is lower. Next thing I do, I will program the pump for secondary infusion with the prescribed infusion rate, the hourly rate, and the volume to be infused, which is usually the amount of the IV bag. Next, I'll go ahead and unclamp my medication, my secondary, so that it can be flown into the primary, and then I will unclamp the administration tubing all the way open, and I'm going to press the start on the pump. And then I'm going to ensure that all alarms are turned on and audible. I'm going to check the pump hourly to make sure the correct volume is infusing. And then at the end of the shift, or at time specified by the agency, I'm going to clear the pump of the volume infused and then record it on the INO form. All right, now that I have everything infused, the last thing I need to do is document the procedure. Before that, I'll go ahead and remove my gloves, perform hand hygiene. I'm going to document the procedure. I'm going to document the date and time. I'm going to document my initials, the site location, the type and size of the catheter, the solution that is infusing, the patient response, and the teaching. And then I'll thank my patient, and I will be all done.